a really, really important topic, COVID-19 vaccine. I will just preface this by saying that, as always, I always ask the day before for questions from you guys to talk about, to ask questions to whomever I'm interviewing today. We have Dr. Marta Perez, who's an OBGYN, who's received the COVID-19 vaccine. I followed her experience with it, and it's been a really interesting topic for me as a new mom and also breastfeeding currently to be interested in what's going on with the COVID vaccine, how that might impact me as a breastfeeding mother. And also I have friends who are pregnant and some who are trying to get pregnant. And this has just been a topic that we've been talking about. It's also a big discussion when the COVID-19 vaccine became available to in the world, talking about how the vaccine could potentially affect your fertility. That has since then been discussed. Anyway, when I posted about this yesterday, we had a lot of really colorful comments. So I know that there are some anti-vaxxers who are currently tuning in, who have tuned in or might be tuning in soon and really wanted to get on here and be commenting. We turned comments off because there were so many comments that were anti-vaxxer focused. And while I am all for people voicing their opinions and their concerns, and people should do whatever they want to do when it comes to this COVID vaccine, I also know that this is a Instagram live that is geared towards information, asking questions from people who have questions about the vaccine. And I'm going to be as transparent and open as possible with Dr. Marta Perez. And also, I know that getting this vaccine for a lot of us who want to get the vaccine is a way to return to life as normal. So I am just coming at this as a person who's interested in the questions about this vaccine, as a breastfeeding mom, as a woman, and want to know more. So that's how I'm coming at this, and I'm excited to talk to Dr. Marta Perez about it. Get in for those of you who want this information. And hi, how are you?
You.
Great. I'm so grateful that you took time to do this, because you are also a new mom of a baby. So I know that the schedules are crazy, but I was just saying that that the questions, I got so many amazing questions about this topic and this conversation. I actually originally followed you on Instagram because I became aware, I think from one of my girlfriends actually sent me your documenting your process of getting the vaccine and your breastfeeding. So my friend sent it to me because she knows that I'm also interested in it and I'm also breastfeeding.
Yeah.
So I've watched your whole process. How are you feeling?
Great. You may hear my son who's next to me.
Love it.
He's just hanging out, but there may be a little newborn squawks.
Yes.
But no, I feel great. I mean, I was watching the first few minutes before I jumped on with you, and what you said is exactly right. This is informational content. If you're someone who is very against vaccination, that's fine. And I would ask those people just to opt out of maybe watching this. They may find it boring, but for everybody else who's just curious and wants information, this is going to be a great place for it. I've also, in being on social media, have interacted with a lot of people who are against vaccines, and I just ask out if it's something that's not for them.
Yeah.
But to go back, I mean, I found out I was pregnant a little bit after you. It was late May of last year, so a little bit after lockdown.
Okay.
And so I worked and was an OBGYN throughout pregnancy. I saw COVID patients. I had lots of exposures to COVID at work. My husband is a pediatric ICU doctor, so he had exposures too.
Mm-hmm.
So we were really excited about getting the vaccine, and I did a lot of my own research and talked to a lot of other vaccine experts about the new types of vaccines, and I was very excited to get it while pregnant. We had thought it was going to be available late December when my institution was rolling it out. They decided to do it by age, so I was lower on the highest priority. And then I actually went into labor early at 35. So I was planning to get it when I was pregnant, but I wasn't able to, both because I delivered early and because in that first rollout, I was later because of my younger age. So I got it when I was breastfeeding. I was about 1 week postpartum or 6 days postpartum, I think.
Okay.
And then because I got Pfizer, the next dose for me was 3 weeks later. And I really did well. I was pretty fatigued after the second dose, which is to be
common.
Yeah. And also to be a newborn.
Yeah, true.
More than kind of normal fatigue. And I had like a slight headache. So I just took like Tylenol. No, I took Advil. I recommend Tylenol for pregnant patients. But overall, like that was really it. It was pretty mild. Everyone has different experiences, but the peace of mind, and I guess you saw the photo of when I got vaccinated, I was crying tears of happiness. Yeah. I was so
I know. I remember actually, I saw the picture that you posted, and then you were also, you know, posting a lot on your Instagram stories, just documenting how you felt, your thoughts on getting the vaccine, obviously it being a huge relief for you being in the line of work that you're in, also for your husband and just for your household. So I totally understood that. When I watched you getting it, I was like, oh my gosh, somebody's getting it that's breastfeeding. I'm so interested in this because, you know, it was so new and there were so many questions and comments that I myself had, like, you know, of course we hear about this vaccine and it's really exciting because life can go back to normal. And there's part of it that's like, this is a new vaccine. I want to get the vaccine when I'm able to. I'm breastfeeding, so that's a part of it. How will it affect my child? I have a lot of pregnant friends who also want to get it. And then I have a lot of friends who are either wanting to get pregnant and didn't know about it affecting fertility. So there were a lot of questions that when I was watching you, I was like, this is going to be great because I can see exactly what's going to be happening and how she thinks and reacts to it.
Yeah, there's a lot that we can go into, and I'm sure we'll jump in just with your questions and the questions your followers gave in a second. But, you know, I saw, because I am friends with and surround myself with tons of people who are in healthcare. So I saw tons of people, hundreds of people tagged me, and mostly Instagram, but also like Twitter, about them being pregnant or breastfeeding and getting their vaccine. Tons of doctors, tons of nurses, tons of physical therapists, just everyone. And, some of the CDC data that came out last week actually showed that 30,000 pregnant people have gotten the vaccine already.
Okay.
Pregnant, that's not even like breastfeeding, which is pretty amazing. Right. And shows that and those are all pretty much healthcare workers, because the age-wise, nobody else has really fits in most states vaccination yet. So that's a huge amount of healthcare workers that felt really comfortable signing up.
Yeah. So I think let's just start from the very top, which is the vaccine safe?
So in the way I like to answer this is it depends on exactly your definition of safe. So the mRNA vaccines and the Johnson & Johnson vaccine, neither of three of them were clinically trialed in pregnant people. So when they asked people to sign up in the trial, they said, please don't sign up if you're pregnant.
Right.
And that is not unique to these vaccines. That's actually completely normal when people are testing medications and vaccines, which is what's so frustrating being an OBGYN, because we are left with like a question mark for things that could really improve the health of both mothers and babies.
Right.
Replace this binky. So that's not unique. They weren't not including pregnant people because of a certain reason. That's just normal, unfortunately. So we don't have data for it, but scientists who know a lot about immunology and about pregnancy and about the placenta and about breastfeeding do not think that it's likely at all, theoretically, that there could be a negative effect. But we don't have the data to say one way or another. With one caveat, we're starting to get data, which I can talk about, which is really exciting. But just from the initial trials, that wasn't included. Now, companies do run what's called DART studies. So as part of the earlier phases, they will basically test the vaccine in animals and who are becoming pregnant or have baby animals, mostly mice and rabbits. And those were all reassuring. Companies that did that, Moderna and Johnson & Johnson did those. And those didn't see like any negative effects. And they actually, in like the Johnson & Johnson, the dose they give the rabbits was like twice the dose that they give humans anyway. For Johnson & Johnson, the mRNA vaccines are new. I mean, they've been in development for many years, but this is the first like debut for them. The adenovirus vaccines, a similar mechanism has been used in Ebola vaccines, and that has been given to pregnant people. So it's the same mechanism, just slightly different. And the safety profile was reassuring for the Ebola vaccine, which is similar.
Okay.
So we don't have exact data for these vaccines, but from all the things we know, we think probably these are safe.
Yeah, and safe, we mean for people who are pregnant and people who are not pregnant.
Yep.
And you were originally anticipating on getting the vaccine as a pregnant person, and you ended up getting it as a breastfeeding person. So when you were thinking of getting it as a pregnant person, and now I'm in California, so we've hit a phase of pregnant people being allowed to get the vaccine.
Yeah.
What would you say to somebody who's pregnant, wants to know whether or not they can get the vaccine, but they're nervous because of what you just said, which is there haven't been studies done on pregnant people, and how do we really know that this isn't going to be affecting a baby at any phase of pregnancy?
Yeah. So that's a really common concern. The biggest thing here is that all pregnant people should have access to getting the vaccine, but every person can make the decision that's right for them.
Right.
So, and they can talk to their doctor, but they shouldn't be required to have a note from them. So if you are first nervous, my first step would be talking to my doctor about my situation. We do know that pregnancy is a risk factor for having more severe disease from COVID. Mm-hmm. Likelihood of going to the ICU, higher likelihood of needing heart-lung machine, even maybe higher likelihood of death. With that kind of serious illness also comes higher likelihood of preterm birth. So there are some real risks of COVID itself in pregnancy.
Right.
And depending on your individual situation, exposures, community spread, et cetera, you're going to weigh all of those things, the risk of actual COVID with risks of the vaccine, which are either minimal or none theoretically. So that's a way to think about it, is that's how I ask people to frame the decision.
Okay. So because I was pregnant, and obviously COVID hit, and it was really nerve-wracking as a pregnant woman, because 1 week it seemed like, the CDC was saying that this vaccine doesn't affect pregnant women the same as it does a non-pregnant person. And then another week it would say this COVID-19 is terrible for people who are pregnant and will cause you to miscarry or have a high fever and have problems with your child. So it was very confusing. And I think the latest is that COVID does affect people who are pregnant in a more severe way than people who are not pregnant.
Yeah, because now that the pandemic has gone on for an amount of time, some of that data was coming out in the summer, but then a bigger round of it came out in the fall, and we're sure now, and there's even more data saying it probably increases risks of like hypertension, like preeclampsia, et cetera. So COVID is, if it can be avoided, is not a good idea to get during pregnancy. Now, whether as the vaccine becomes available, if you're choosing to just continue doing your social distancing, masking, 6 feet, isolation, or choosing to take a step in a way to prevent COVID in yourself.
So what would be, if someone were to be questioning this as a pregnant person, is it worse if someone's like, well, if I got COVID, is it 100% that something would happen negative with my baby if you're pregnant? Or is it a more sure thing to get the vaccine and run the risk of, it being a new vaccine and not knowing 100% what kind of an impact it would have on the baby?
Yeah. So, and this is kind of a hard thing to discuss just because it's complicated to say. Of course, if someone got COVID while pregnant, there's not 100% chance something bad will happen. Some people still in pregnancy have asymptomatic infections, just the way outside of pregnancy, some people have asymptomatic infections. It's just higher risk that you'll get more sick than someone who's the same age, sex as you, same medical conditions as you're higher risk for being pregnant. We don't quite know all of the effects of COVID itself in pregnancy. It looks like from data we've seen that the virus itself probably does not cross through the placenta and infect the baby while pregnant. However, there are some blood vessel changes, et cetera, that we see with COVID in the body, and we're not exactly sure of really how those changes could affect the placenta and could affect the fetus negatively in that way. So we're not quite sure of all of those risks to the fetus with COVID, but we of course know that a sick mother is not good for a fetus. Like what we like to say in OB is like a baby doesn't tolerate a dead mother, right? And that's like a kind of the most severe form, but even if you're having trouble breathing and your oxygen levels are low, that's not good for your baby. So there's real risk there. And as far as the vaccine, So we don't have real data yet, but the last week the CDC came out with some data. So of those 30,000 healthcare workers who were pregnant who got one of the mRNA vaccines, the CDC is going through and actually calling people and getting medical records and following babies after they're born. So far, they've only made it through 1,800, but that's actually a lot. And they compared pregnancy outcomes, like rates of complications, pregnancy complications, and rates of fetal or neonatal complications with a baby between like the general population and the people who had gotten the COVID vaccine, and they were exactly the same, or like a complication a little bit, maybe less in the vaccine group, which is great. So in that group, we did not see any increase in complications with the pregnancy or outcomes for babies when they were born.
Okay. And if one of the big questions that came up when people submitted questions was, is there a difference if you have the option of getting the vaccine and you're choosing between Pfizer, Moderna, and the Johnson & Johnson, is there one that's better for pregnancy, breastfeeding, or fertility, or are they all the same?
At this point, they're not the same. Definitely not a difference between Moderna and Pfizer. They're very close vaccines anyway. And for Johnson & Johnson, I don't have any data to say there's one better than the other. So given the actual risks of COVID itself in pregnancy, I would say if you're choosing to get the vaccine, get the one that's the most easily available to you.
Okay, so it doesn't matter as far as if you have the option between Pfizer and Moderna, just get one.
Yep. And if you have the option between Johnson & Johnson and the mRNA, at this point, I don't have any recommendation. Now, years down the line, we might say, oh, this one was a little bit better, but compared to the risks of COVID, just having the vaccine, if you're choosing to get it, is going to be what's really going to protect your health.
Okay. Now let's go to fertility, because that was also a big topic. When the news about the vaccine coming up first came out, I remember a lot of my girlfriends sending to me articles or just calling me, and we would discuss getting the vaccine. Are we going to do it? Are we not going to do it? What was the situation about it? I would talk to my mom about it, my sister, and what that would mean for future children. If you want to have a baby in the future, I have some girlfriends who are trying to get pregnant, some who have already had kids, some who want to have kids in the future but aren't ready yet, and what that vaccine could mean for your fertility long-term and also immediate. And I feel like there was a rumor that went around, because I talked to my OB and she said that it was a rumor that went around that said the vaccine will negatively affect your chances of getting pregnant in the future, will have, a really bad effect on your eggs and just your overall ability to get pregnant. And so I think that for me, at least, I looked at that and I was like, wait a minute, what does that mean? I want to have more children. What does that mean? And a lot of the girls that I know were also feeling a little bit unsure because of that rumor, but it has since been said that that is not true.
Exactly. Yeah, that is completely false. The basis of that misinformation was somebody basically saying, like, is there an overlap in the protein that the vaccine targets and a protein in the placenta? And the answer to that question is no, there's not an overlap, so there isn't a concern. So there's no concern at all with the vaccine.
Can you explain what that means, just for people who don't understand about the protein?
Yeah, so the way the vaccine works is it helps your body to recognize the spike protein on the virus and create antibodies that fight it. So someone asked a question that then went viral just because they were asking it is there an overlap in that protein that the antibodies are going to target and a protein at the placenta? And that wouldn't even be fertility. That's another thing that this totally snowballed, this misinformation snowballed. It's not even fertility. That technically that would be like miscarriage. But the answer to that question is there isn't an overlap. Right. So the New York Times article that addressed it, and the quote that was in it from that doctor in the New York Times article was something like, it's like saying that a rhino and a zebra are the same animal because they both have on like the same collar or something. Like, yeah. They're completely different. There is no concern there. And in fact, as doctors, there's big organizations that represent types of doctors. And so fertility and infertility doctors, the doctors who address infertility, do IVF, are heavily invested in helping their patients to conceive and get pregnant. They have said so strongly there is not any concern. Their professional recommendations are that anyone attempting pregnancy absolutely gets the vaccine, even if they're in the middle of fertility cycles. Because protection from the virus is so important in their patients. So that's a really strong statement from the people who are the most heavily invested in fertility and pregnancy.
And one of the other big questions that came up was, if you are trying to conceive, because you just brought that up, there are people who are trying to conceive. I also have very close friends who are trying to conceive and wanting to know what is the timing in that process of, do you get the vaccine and wait 3 months? How do you flush it out of your system? Because with the flu vaccine, some people get the vaccine and want to wait one period cycle to flush it out or just for themselves. But is there any information on that when it comes to this vaccine?
No, again, that society, the Society of Fertility Doctors, which is called ASRM, or the American Society for Reproductive Medicine, they again say, start the vaccine when it's available to you, get the next dose when it's scheduled. It doesn't have any impact on your fertility treatments, trying to get pregnant, no need for delay. Same with flu vaccine, because that's known to be safe in pregnancy or conception as well. So there's like really no data or no recommendations in which to try to space things. I mean, people will make their own choices, but there's nothing to base that off of. And if I was in the shoes, or if it was my own sister in the shoes of trying to get pregnant or undergoing fertility treatments, I would say these things are not related and not to worry about them timing wise.
Okay. And this might seem like a stupid question, but that goes the same for men who, might be concerned about it affecting sperm.
Yep. No, there's no data that the vaccine could affect sperm in any way.
Okay. So when it comes to breastfeeding, I myself, I'm breastfeeding, and I was obviously very interested in your experience getting the vaccine. When I saw you get the vaccine as a breastfeeding mother, it made me even more interested. But my biggest concern, and there has since been, I believe, a lot of research about this, about how your breast milk is affected when getting the vaccine and whether or not that's beneficial or harmful for your baby.
Yeah. So I think this is a good time to we'll talk about breastfeeding, but also pregnancy, because we're just starting to get the beginnings of some science about how the vaccine can pass immunity, either during pregnancy or during breastfeeding. And this is really exciting. Again, this is early data. So, if we come back live, like in 3 months, there could be stronger data one way, or one thing could have been a little bit different. But what this early data is showing, and I have links to this on my Instagram if anyone wants to read it. It hasn't been peer reviewed yet, but it just got put out there, is that when one study followed pregnant people and breastfeeding people after the vaccine and looked at bodies in the bloodstream of the pregnant or breastfeeding person, they were able to look in the umbilical cord blood sample as well, meaning the baby, for some of the people, not all of them. And they found that there was a really good antibody response in the pregnant and breastfeeding, which is great. And when you're talking about passing on immunity to a baby, either during pregnancy or during breastfeeding, the type of antibody matters. IgG is our body's kind of strongest memory antibody, and that readily passes through the placenta. That's exactly why we do recommend getting the flu vaccine and Tdap during pregnancy, because IgG does a really good job passing through the placenta to the baby. It stays in the baby for a few months after birth, which is great. They did see a strong response of that antibody, which is really great for those pregnant vaccinated people. IgA is the type of antibody that passes through breast milk and then coats a baby's GI tract. Okay. And so a bug kind of gets in the GI tract before it gets to the respiratory tract. It has a better chance at attacking it. Uh-huh. That's how breastfeeding can decrease the risk of some respiratory viruses for babies. That study didn't find IgA response in the bloodstream of women who are vaccinated. So what that tells us is, breastfeeding is still awesome. And it's still really awesome that you are going to prevent yourself from getting COVID by being vaccinated and bringing it to your family. But perhaps if you had a choice of pregnancy versus breastfeeding and you're only deciding based on protecting your baby, it might be a better idea to get it during pregnancy than breastfeeding. Now, many people are going to be like me and like you. The first opportunity to get the vaccine is during breastfeeding. Mm-hmm. And so that's great too. I mean, protecting yourself and your family is great. There was one other study that was smaller than this other study that did see some IgA specific to COVID in vaccinated breast milk samples. So I would say the jury is out on breastfeeding. We have one study saying maybe not, and one study saying maybe it does pass, but there's good in that first study, there were pregnant people also that had a good antibody response, which was really encouraging to see for the people who are choosing to be vaccinated.
So in other words, being able to get the vaccine while breastfeeding is safe in the sense that if it does end up passing antibodies to your baby through breast milk, that's great for your baby. And if it doesn't, that's also okay for your baby.
Yeah. And if it doesn't, at least you're protected, which there's nothing, being really sick from having an infection isn't good for the breastfeeding relationship. You feel like crap, you get dehydrated. So
right.
Preventing yourself from getting COVID, you're protecting your breastfeeding relationship to a degree.
Okay. And if it turned out that in 3 months from now we came back and talked about this and it turned out that there were antibodies in breast milk that were beneficial for your baby to be receiving, what does that mean for your baby as far as your baby's immunity with COVID and how people can be around or interact? I know that recently this week, CDC came out and said that people who've been vaccinated with both vaccines can hang around or spend time in small gatherings with other people who are vaccinated. But what would that mean for a baby?
I would say it would be really encouraging. You know, one of the very encouraging things we saw early on, and by early on, I mean like the summer and fall, is that even though we were seeing these worse outcomes for pregnancy and COVID, we were seeing that patients who were pregnant at the time that they had their baby and positive with a newborn, we weren't seeing severe disease in newborns. Newborns and infants, although it's not impossible for them to get severe disease from COVID, they really tolerate it very well. And you kind of see that through some of childhood too, although there is MIS-C. But it appears that newborns tolerate it very well. So it's awesome to protect your infant. But in general, infants are going to be a little less vulnerable than older children and adults. So I would say the more people that are vaccinated, the safer everyone is, including an unvaccinated infant. And if we find out antibodies are even helping the infant even more, then that's even better.
So as a breastfeeding mom, you would say, get it, because of course it's up to everybody on their own decision, do whatever you want. But as somebody who's myself interested, get it when it's available. If it does end up giving my baby great antibodies, wonderful. If it doesn't, I'm protected myself.
Exactly.
Okay. And then if people are wondering about autoimmune disease and the COVID vaccine, do you have any opinion or thoughts on that?
I would say when you're talking about autoimmune disease, there's a really wide spectrum of severity of autoimmune diseases, and especially the types of medications that are used to treat some autoimmune diseases. So I would say talk to that person's individual, either like rheumatologist or GI doctor, depending on what disease they have, about specific concerns. There are some treatments like antibody treatments that you have to kind of wait to receive the vaccine. But other treatments are totally approved and are really safe if you have an autoimmune disease. So that's just like a caveat to talk to that kind of doctor, since I really like to stay in my lane as an OBGYN.
Okay. And then the other thing that I think is really, I mean, for me personally, with this being a new vaccine, and as somebody who in the beginning, when I heard about the vaccine, I was nervous about, I grew up getting vaccinated. I get the flu shot. I'm fine with vaccines. But it is a new vaccine, so there are parts of that would make me, and I think make a lot of other people, just nervous about, here we are, however many months in on the vaccine, and is this going to be one of those things that we all get vaccinated, and then in years from now, we're looking back at all of us and saying like, oh my God, they all have this problem, they all had this issue because they all decided to hurry up and get vaccinated. What would you say about that?
So we've actually, in the history of vaccinations, never had that happen. We've never had it happen where vaccinated for everyone looked back and said that wasn't a good idea. Vaccines were improved. Many of our parents have a little scar on their arm from vaccination that it worked, and so we don't have it. Now vaccines are improved. In fact, my little one got his 2-month vaccines last week, and the amount of kind of like, it's called antigen load, or basically the amount of active ingredient in vaccines over years has gone down because they work so well. We're like, oh, well, if this works, how much? This much.
Right.
But we've had a situation where a vaccine has made it to the public, and then we've looked back and said that wasn't a good idea. There were risks that we didn't pick up. Now, there's been tons of vaccines that have been created, and we realize, oh, that doesn't work. Or too many people feel really crappy. and they never make it to the public. And these vaccines, although they came really fast, because of COVID being an epidemic and because there's so much collaboration between scientists, it happened faster, but none of the safety steps were skipped. So most vaccine reactions happen within the first several hours or several weeks. And all of that time was allowed to pass before the emergency use authorization, because those trials were going on starting in months ago. And so by the time there was emergency use authorization, they had to wait a certain amount of time. And so they waited the time that you would likely see an adverse reaction, and we didn't see them. And in our history, we don't have a situation where we've prevented an illness via vaccine and then looked back and said that wasn't a good idea. So that's really just about science and stuff. About the new types of vaccines, I completely understand being hesitant, like, whoa, this is totally new. You know, I felt a little bit of that until I really researched how mRNA vaccines work and how adenovirus vector vaccines work. And when I looked at the science, I was like, this is so cool. Like, this is so awesome that they can create this, like, such a smart vaccine that can do something so effectively and without risk. So I think it's like, I was even more in support of it. But I talked about this on Instagram before for my followers and stories. Like, if you feel apprehensive, that's totally fine. And I want everyone to recognize that it's okay to not feel like I was so excited, I was like gonna bash the door down to get my vaccine. But if you that way, like, that's okay. Make the decision that feels the best for you. Like, if you feel 70% sure you want it, but there's a little bit holding you back, but you're like, mostly I want it, that's okay too. Like, it's really hard in life. We almost never approach things 100% sure of anything as a person. You know, there are very few things. So if you're 80%, 70%, or the opposite, only 30%, you decide not to get it, that's fine. Just listen to what's right for you, even if you have a little bit of doubt or a little bit of hesitation. Only you can make the decision that's going to make you feel empowered and really good and protected.
I think what's really also exciting is being able to have that report like we have this week from the CDC that says if you have been vaccinated with both vaccines, that you are allowed to spend time safely. Because I know there are a lot of people who have already been spending time with other people, which is why we're still where we are. But you know, being able to say, okay, you're double vaccinated, you've done your full vaccine, and now you can go hang out safely with someone else who's also been double vaccinated. And I think that is really encouraging, at least it was for me, to be able to see that as someone who was in the beginning looking at the vaccine as a little bit like, this is new, this is really fast. And to see that people are allowed to have some level of interaction with people outside their home or their pod is a really exciting thing.
Yeah, and those 30,000 people who are healthcare workers who got it pregnant and they didn't see any more adverse events than people who were not pregnant, and the 1,800 people who are pregnant and had the same amount of no more complications in pregnancy or no negative outcomes. That was great. And these small studies coming out saying, yeah, the immunity probably passes to baby with pregnancy and may or may not with breastfeeding, but still no, not negative. Right. So especially, as I'm sure you can relate to too, the postpartum period and having a newborn is a little bit lonely. So looking forward to being able to have even a few more people who it might be safe for you and your baby to see gives us a lot of hope.
And as, of course, you've gotten the vaccine and you have your baby, what does that mean for your baby, out of curiosity? If you have somebody come over who has had the vaccine, but the vaccine is not 100%, do you feel totally safe and comfortable having that person around your child unmasked?
That's a great question. My baby came early, and so he did fine from a respiratory standpoint, but early babies are at increased risk. And even full-term babies, that first month of life, even normal viruses can be very dangerous for babies. Yeah. So even outside of a pandemic, we probably wouldn't have had visitors coming in the first month. He's 2.5 months old now, so we're a little bit past that. And everybody distancing and wearing masks has actually done a really great job at reducing flu and RSV. My husband is a pediatric ICU doctor. Most of his job this time of year is RSV, and it's like nowhere to be found, which is great.
Wow. Yeah.
But for COVID itself, we still were encouraged that some, even though we don't have data, there's likely a less chance of someone having infection or passing infection if they're vaccinated. We still go by like, what are your background behaviors? You know what I mean?
Yeah.
So, but we're lucky in that our families and the people our friends are in healthcare, and everyone I know has done things that I feel comfortable. They mostly are completely quarantined, and except when they're at work and wearing masks and everything. So I would say it's not like we're like totally everyone can come over individually or whatever, but we do take into account, but it just gives a little reassurance to like, okay, well, that person's fully vaccinated, like it's probably safe.
Okay. So you would feel comfortable having somebody. I also asked just for myself, because as I'm knowing people who are getting vaccinated, and that was a question people were asking, if you yourself aren't vaccinated because you're not on the list of being eligible to get the vaccine yet, but you have people who are around you who have gotten the vaccine, you know, you want to be able to, of course, when you go to the grocery store, still be masked and socially distant. But if you know somebody that is, you know, around you that has been vaccinated, both vaccines, do you still need to be socially distant from them? Can they spread the virus to you? Should you be masked? What is the correct?
We don't have the data to say if it's possible to spread the virus, but likely it's going to be less risk of that. And hopefully we'll have data in a little bit. Just because the vaccines are so good at preventing severe disease, they probably are preventing some aspect of asymptomatic disease and spreading, though we don't know that. We have to wait for that data. I would say, based on what the CDC came out with, they said, you know, in one household, if somebody is fully vaccinated and the other person doesn't have any high risk category. So if it's you and your baby and you don't have any other high risk issue, then I would say that a fully vaccinated person and you and your baby could be around each other unmasked. But if you had a high risk condition, then maybe keep the masks on. Does that make sense?
Okay. Got it. Yes, that makes sense. I think it's all really interesting, just because you know, I think people think, oh, I got the vaccine, I can just kind of go back out into the world and be unmasked and go to the grocery store and be around people. And, you know, and I think that there is, you know, you see Dr. Fauci and you hear doctors like yourself that say, you still do need to be practicing socially distanced behavior, masked, and go out into the world when you need to. However, there are a huge amount of people who are not vaccinated yet. And also there is a small risk that if you are vaccinated fully, that you could still get it, very unlikely, but you could still get it. And you could still, very unlikely, but you could still also spread it.
Yeah. The mRNA vaccines didn't test specifically for asymptomatic infections, but the Johnson & Johnson vaccine did. They tested their vaccinated arm for asymptomatic infections, and it decreased asymptomatic infections by 77%, which is a major decrease in the asymptomatic infections, but it wasn't 100%. Okay. So it's possible, but it's much lower risk. One thing I would say too is that, like you said, we don't have the data yet. We're not there yet, but we're seeing numbers drop because people are getting vaccinated and we're still doing mitigation measures. If they continue to drop even more, as more and more people are vaccinated, we will eventually get to the point where life will start looking more normal, but we're just not quite there yet. And I think if we look at the last 2.5, 3 months, been really great progress. And so I would say to people who are like, we're still not there and we're getting a vaccine, we're so close. We're so close.
Right.
And especially thinking that more vaccinated by the time the spring is over and that summer is here, I would just tell people we're getting really close. Hold on. This is really hopeful information from the CDC about vaccinated people being able to hang out together and other low risk people. So we're close.
Okay. Well, that's really encouraging. I am, again, so grateful that you took the time to do this. And I know you have your little one sitting right there, so I will let you go. But I definitely, I mean, there are tons of questions that I got, and I could probably sit here for hours longer and talk to you, but we both have babies to get to. But I think we'll come back, hopefully, and maybe do another one of these, just because the information is constantly coming in. It's constantly changing. The vaccine is becoming more readily available to different categories of people. So it would be interesting to circle back after more information comes out, which seems to be all really exciting and encouraging. And Again, thank you so much. This was so informative for me as a breastfeeding mom to be able to talk to you and just feel more comfortable about it.
This was really exciting. Thank you for having me. And for anyone here who wants more information, I break things down mostly in my highlights on my Instagram. I don't post it much anymore. I don't know, just with having the baby that I have like my phone in one hand.
Yeah.
So I have I break down the studies that I mentioned and different CDC guidelines. I also have links to American College of OBGYN, ACOG's guidance, and Society for Maternal Fetal Medicine going into answering a lot of questions that people may have that we didn't get to.
Yeah, and also I'll make sure to put all of your information in this description video when I post it, because I of course follow you, but I think it is really interesting and helpful just to be able to read it or hear you say it on a different time or a different day, to just be able to absorb the information, because even though we've asked it here today, there are people who want to ask it over and over again to be able to get a little bit more reassurance, and I totally understand that myself. So thank you again so much, and have a great time with your baby, and we will schedule another time to come back and do this again.
Excellent. Thanks, Katherine.
Awesome. Thank you.